Microneedling is an in-office cosmetic procedure that we offer in our office, and we use a device called Skin Pen, which has 12 very, very tiny needles at the tip that you don't see during the treatment, but basically it feels like a cat licking your face, but a little more than that. So because the treatment is a little uncomfortable, we do recommend and place topical numbing cream for 30 to 45 minutes on the skin prior to the treatment. And with that numbing, most patients tolerate the treatment with a very minimal pain, maybe up to a 3 on a scale of 0 to 10. And recovery is 1 week, in which the process is basically you're super red, you look like a bright red beet, which is normal. And then you kind of look like you got a little like bad sunburn for a few days, and then it kind of turns dark and almost like a scab forming in all those little spots, and then all of a sudden it just sloughs off after about 5 to 7 days. For the treatment, we usually recommend no sun 2 weeks before and 2 weeks after the treatment. You may pre-treat with Retin-A if you're on Retin-A, so that's fine. You may even pre-treat with some lightening cream if you're on that. It's usually to treat acne scars and facial wrinkles as well as enlarged pores. I love this treatment for skin texture improvement issues. Just does a great job of giving you kind of a clean slate, a fresh new layer of skin. It definitely helps with some pigment issues too. So you'll see kind of the darker areas brighten up a bit, which is a nice side benefit as well. So the thing with microneedling is that I too find it very hard to take and prove that it's effective based on before and after photographs. Most of the time when we see patients back, they tell us that they've really enjoyed and seen the improvement and felt the difference in their skin. And unfortunately, that type of improvement is very hard to photograph. So I think for microneedling before and after photos, it is always kind of one of those treatments that just doesn't show much improvement just on the photos. But the patients do love it, and they do come back for more, and they do feel and notice the improvement in texture on their skin. So I do think microneedling is not something that would be great for every patient, especially like a thin skin patient. But for thicker skin patients or those who have acne prone skin or like large pores or even wrinkles, microneedling can be a wonderful treatment. And I would always couple this treatment with obviously topical skincare and possibly some injectables as well to help improve in addition to the microneedling. So the most common area we treat with microneedling is the face, avoiding the eyelid area. But the neck, the body, anywhere can be treated actually, as long as the practitioner is comfortable treating those areas and knows the parameters that are safe. Most patients are scheduled for a 30-minute session with the provider and asked to come 30 minutes early for numbing. So you'll be here for about an hour and a half, including the check-in and post-recovery instructions and checking out. But the procedure itself only lasts about 15 minutes. Microneedling results will last about 3 to 6 months. For patients who need correction, I have them come every 6 weeks for 3 to 6 sessions, depending on the severity of what we're treating. But most patients will need a touch-up treatment at about 6 months, and I recommend patients come at least once a year for maintenance. With older skin types, you do need to be more careful with microneedling because the older skin types have thinner skin. And not to say you can't do microneedling, but it's a little bit more traumatic and possibly could lead to adverse events such as scarring, discoloration, and extensive healing time. Okay, so microneedling is not the most tolerable procedure for many patients, but thankfully we have this amazing numbing cream that we call the BLT. It's a combination of beta-caine, lidocaine, and tetracaine cream. With this cream applied for 30 to 45 minutes with an occlusive wrap, patients tolerate microneedling extremely well. Microneedling should not be performed on patients with super thin skin, fragile skin, sensitive skin, reactive skin. Those patients can have prolonged redness, discoloration, prolonged healing, and even scarring from microneedling. They do sell microneedling home kits, but those devices do not penetrate the skin at nearly as deep as what we have here at our disposal in the office. However, those devices can improve skin textural issues such as wrinkles and pores, but use with caution and obviously with some common sense and judgment, because you can get infections because they do needle your skin, which allows bacteria and other foreign invaders of the skin to actually penetrate and cause an infection. So please be mindful of keeping it sanitary and also not overdoing it. When in doubt, I would say just back off and consult with your dermatologist for further guidance. We do usually recommend 3 to 6 sessions for correction, depending on the skin type. If the patient's more severe, obviously more like 6 treatments. If they're more mild, then we might just say, okay, you just need 3 treatments and just maintenance from there. Microneedling is one of the most common cosmetic procedures we do, but in terms of recommending it to patients, it really has to be a patient who's invested in their skincare, understands that microneedling alone is not going to be the only thing that they're doing. They also need to be invested in doing their skincare routine, some topical regimens, maybe some injectables in the office to help along on their treatment path. I often combine microneedling with injectables like Sculptra for acne scarring, Botox for wrinkles, and obviously skincare, because we need to keep that collagen building as much as we can. Oh, microneedling with PRP is just basically microneedling on steroids. It heals faster, it can be more effective. With the PRP, you also have to be here for longer because we have to actually draw your blood here in the office, and we have to spin your blood down in our centrifuge, which takes about 20 minutes. So it's for patients who want a faster recovery, can afford a more expensive treatment, and don't mind having their blood drawn.